It is now my pleasure to introduce licensed clinical professional counselor Dana Hall, who will be presenting Navigating the Emotional Impacts of Spondyloarthritis and the COVID-19 Pandemic. Dana Hall received her BA in Psychology, summa cum laude, and graduate degree in Community Agency Counseling from St. Xavier University in Chicago, Illinois. She's been a licensed clinical professional counselor for over 15 years. Dana holds advanced training and certification in the following areas: Certified Clinical Trauma Professional, Certified Clinical Anxiety Treatment Professional, Certified Family Trauma Specialist, Addictions-Informed Professional Certification, and she's also a member of the American Counseling Association. Dana has nearly 2 decades of clinical, research, and leadership experience in the field of psychology. As a private practice therapist, she specializes in chronic illness management, trauma, and relational issues. She leverages her clinical work with social justice advocacy as an author, public speaker, and activist for inclusion and trauma-informed practices in education and counseling. She is an accomplished author with 2 new books which debuted this year: Beyond Words, A Child's Journey Through Apraxia, and We All Belong, Musings on Inclusion, Acceptance, and Kindness. She's been featured in Chicago Parent Magazine and written articles for Deep Soulful Love and A Chronic Voice. She founded the Beyond Words movement on social media to create awareness for neurodiverse children and adults. She's married and has 3 young children who keep her grounded, thankful, and hopeful for a brighter future. Welcome, Dana. We're so excited to have you with us.
Thank you so much. I'm going to go ahead and share my screen. Hopefully I'm doing this correct. Give me a moment. Okay. So, in 2010, Christine Misuranda was a college student living with lupus. She and her best friend were sitting in a diner, chatting about life in general, when Christine pulled out medicine to take with her food. Her friend asked what it was like to have lupus. Christine used spoons to illustrate energy. Healthy people have a theoretically unlimited supply of spoons every day and can take this for granted. Those living with a chronic illness know that their spoons are limited. They must plan their day accordingly, conserving what energy they have when they can. That way they can focus on what is most important for that day. It is important to understand that this dance with the spoons is an ongoing daily occurrence. There is no break or holiday for those of us with chronic illness or pain. Spoonies cannot just do it. Whatever it is must be planned and prepared for, some days or weeks even in advance. The good news about spoon theory is that it can help to not only explain to people what life is like with chronic illness, but also it can empower the person with a chronic condition to set boundaries around their time and energy. It is difficult to always budget energy, and often others struggle to understand our limits. However, we know going too far often leads to painful and debilitating flare-ups. Again, my name is Dana Hall, and I'm a clinical psychotherapist in the state of Illinois. My specialty is working with chronic illness and trauma. In addition to this training, I'm also diagnosed with fibromyalgia and a chronic migraine disorder as of 2013. As a fellow Spoonie, I appreciate the time and energy you have taken to be here today. I'm going to check in with my slide here. Okay. You have a collection of medical professionals at the Spondylitis Association of America and in your personal network to advise you on treatment for physical symptoms such as medication management, physical therapies, and alternative treatment strategies. Today, I'm here to talk about the psychology of coping with SPA, especially during COVID. This presentation is not a substitute for the treatment you have currently in place. Any psychological techniques discussed are meant for educational purposes and not to serve as a form of treatment. If you are experiencing depression and/or anxiety, please talk with your treatment provider and follow the recommendations at the end of this presentation to locate a qualified mental health provider in your area. There will be a few exercises in this presentation. I'll offer you an opportunity to practice some of them with me. So if you have a pen and paper, feel free to keep them handy. Since this presentation will cover SPA in a general sense, I want to take a moment to honor the various paths our diverse group represents. For those watching as support persons, spondyloarthritis, SPA, is a term used to describe a group of inflammatory arthritic conditions, the most common being ankylosing spondylitis. Physical commonalities of SPA are inflammation that attacks the spine and, in some people, the joints, arms, and legs. It also involves skin, intestines, and eyes. As we look at those commonalities, we know a lot of us have gone through the process of diagnosis, which includes some intensive work such as blood work, x-rays, medications, many specialists. We work together to build support communities like we witnessed today in our support groups that are now virtual. We share in commonality with joint pain, aches, fatigues, inflammation, and flare-ups. Altering our life is something that we've become accustomed to. Fighting for services and supports is something that we do on a regular basis. However, no matter our condition, we all need hope, connection, resources, and greater awareness throughout our society to abolish ableism and obstacles to gaining services, as well as the need for greater representation. You can see on the slide various paths that some of us have taken with SPA. This presentation is going to look at the biopsychosocial implications of chronic illness. These are the three areas that we'll look at today. Chronic illness is woven into the fabric of our life. We fight for our health daily in ways most others will never understand. Without a moment's notice, we find ourselves trying to navigate, I need to not let this control my life, to I need to stop and listen to my body. As much as chronic conditions can increase feelings of loneliness and isolation, in 2012, the CDC estimated that axial spondyloarthritis may affect up to 1% of the US adults, or an estimated 2.7 million persons. In addition, according to the National Center for Chronic Disease Prevention, 6 out of 10 adults have a chronic illness, and 4 out of 10 adults have 2 or more conditions. Given the rise in COVID cases, we are likely to see the numbers of the chronically ill increase, as the lasting neurological effects of COVID are just starting to be uncovered. Now more than ever, we must focus on our wellness in very strategic and intentional ways. The neuropsychology of pain and the biopsychosocial model of treatment provides ways to address symptoms of chronic conditions so that we can live longer, more productively, and with a higher quality of life. Therefore, this presentation will focus on these 3 areas. 1, furthering our understanding of pain and how we can use cognitive techniques to improve mood. That's the impact of chronic pain on the brain. The learning outcome there that we can take away today is, how can I reframe negative cognition? There'll be an opportunity for us to do that together. The second is examining the impact of external stress on symptoms and the unique challenges brought on by COVID-19. This is the middle section. We'll look at the role of trauma, microtrauma, habituation, and our learning outcome will be how we can promote a more holistic view of wellness. And 3, cultivating resources, supports, and navigating through grief by taking control where we can. And this is where we look at how we build greater self-efficacy. Behind every chronic illness is a person fighting to find their way in the world. I love this line at the end of this quote about how we're just trying to deal with unwanted limitation in our hero's journey. We have a little extra in our path. And today we're going to look at some ways to navigate through that. We have come to learn more about pain, and thus this information can better inform our practices of healing. These new understandings may be why old ways of coping might not be working for us. So here's what we know. Chronic pain alters how the brain works, and nerve cells can deteriorate faster. Therefore, working your brain by learning new tasks, changing your routine, or attending thrilling seminars may help ward off anxiety, depression, and stimulate other parts of the brain. Pain is not purely physical. At times we have been told in a very diminishing way, it's all in your head. That is not what is meant here. I want to validate your physical symptoms of inflammation, rash, swollen digits, tissue, joint damage, all very common to SPA, and add that the brain is registering pain responses even when we can't see these physical injuries or flare-ups. The bottom line is, don't let anyone tell you that flare-ups are not real. They very much are. Pain is not necessarily produced in the area of the body you feel it. Pain messages come from the nervous system. This is why no two people experience the same injury exactly the same way. This can account for some of the challenges that we may have faced in our diagnosis and treatment. If you have met one person with SPA, you have met one person with SPA. Pain is not bad. This is another truth that we're coming to terms with, I suppose, those with chronic illness. That pain truly isn't bad. It's our body's way of protecting us. However, given the implications of chronic pain, the association does get made that pain equals bad, which can distort our relationship with pain. We can also set unrealistic expectations regarding pain management and interpretation of our pain, which can lead to stress. And we know when we develop stress, we have an increase in cortisol, which increases our chances of having flare-ups and unwanted and undue stress and burden. Chronic pain can make the nervous system hypersensitive, which means it can send big responses to regular incidences. Neurologists explain this phenomenon by saying, that which fires together, wires together. It gets everyone on board at the slightest indication that there will be pain. That means carrying a box of Christmas lights up the stairs and you turn just a little bit and you get a strain in your back can kick off the nervous system's response to that pain and generalize it throughout your body. And bam, there we are with a flare-up. However, the good news is that the brain and nervous system show more plasticity than we originally thought possible. The brain can renegotiate its relationship with pain. It can learn new ways to process. In particular, through cognitive behavioral therapy and acceptance commitment therapy, the brain can learn ways to calm catastrophic thinking, thus reducing stress and creating more adaptive shifts in our cognition. This equals lower subjective pain reports and leads to increases in our daily function. The slide here is a little bit of a summation of that. The longer pain exists, the greater it becomes, and the more prone to feelings of fear, anxiety, and depression a person may be. That is absolutely why we have to look at treating the brain when we look at treating pain. You can see the image here of the chronic pain brain. It's lit up in places that the healthy brain is not. We have to be careful of our overgeneralization when it comes to pain management. Ring the bells that can still ring. Forget your perfect offering. There is a crack in everything. That's how the light gets in. It's a nice phrase, little mantra to remind us to stay focused on what we can control. So I want to move into the first strategy of treating the idea of our brain creating more suffering for us and looking at that reframing of our thought process. So we're going to look at cognitive behavioral therapy. As the Institute of Medicine explains, chronic pain is a condition influenced by biology, psychology, and social factors, and is optimally managed by treatments that address not only its biological cause, but also in its psychological and social influences and consequences. Cognitive behavioral therapy originates from Dr. Aaron Beck and ultimately focuses on the interrelationship of thoughts, feelings, and behavior. The premise is that reframing cognition will influence the system from the top down to improve how an individual copes with their pain. For example, if someone thinks, who will want to go on a date with someone that can't even walk for long periods of time? This thought may lead to feelings such as despair, rejection, hopelessness, sadness, fear, these feelings will impact the behavior choices one makes, and they may end up canceling that date. Cognitive behavioral therapy focuses on the maladaptive thinking patterns that stop an individual from engaging in healthy coping. The idea is change the thoughts, change the outcomes. So when we look at the diagram on the right of the screen, it's a pretty traditional example of cognitive behavioral therapy. We look at the bottom right corner, it says thoughts. Those thoughts influence how we feel. How we feel influences what we do. What we do then influences how we think, and it just goes round and round. So as you can see, it's so imperative to look at wherever we catch ourselves. I say thoughts because I come from more of that cognitive behavioral background, but perhaps you catch yourself at the feeling or at the behavior when you're not able to go out and do something. You catch yourself there. We can look at these moments and retrace them and look at any thoughts that may be contributing to the outcomes. Another example next to that is the cognitive functional therapy example. This can be especially helpful when a person who has pain has it on movement. In this case, they may tend to avoid doing things that provoke their symptoms. They rest, but unfortunately, this is not a helpful treatment as it leads to secondary stiffness and weakness, causing worsening of the symptoms that lead the individual to trying to avoid more and more interaction. Inability to function leads to a loss of roles and self-esteem with the progressive intrusion of other problems like financial hardships and strained relationships. Thus, it really requires confronting the boundaries of pain and finding ways to avoid fear-based coping. This doesn't mean that some days we're physically unable to cope or move. We understand that those days happen. However, the projection of fear that we'll have one of those days is what this model is looking at. And we can see the two different paths that can take for us. So we want to exact control where we can. CBT in practice. I want to especially hone in on this. As time goes by, a patient with pain can develop behaviors such as pain magnification, or catastrophizing their pain. This means ruminating about it and lingering on that perceived inability that they have, that they'll be able to cope with pain. This leads to fear-based avoidance. Many individuals with chronic pain may also have mood, anxiety, and sleep disorders, and CBT can also be used to treat these conditions. There's no standard protocol for cognitive behavioral therapy, but there are many techniques that help clients gain the tools to manage life more effectively. Some specific techniques that I often include are relaxation training and body awareness. This means posture awareness, somatic awareness, setting and working towards behavioral goals, typically including systemic increases in exercise and other activities, guidance in activities that lead us to better pacing, keeping structure, which will help in terms of stress management, looking at systems of stress in our life and seeing where we can reduce, and also looking at problem solving, assertiveness training, because we know that we are stepped into a position of advocacy, and we also look at components of cognitive restructuring. We will take a closer look at cognitive restructuring in a moment, as this approach is great for the management of chronic disorders as it aims to build self-efficacy, confidence, and adaptability while providing hope and opportunity for change for the person with pain in a person-centered manner. Before we get there, I want to look at one other approach that I like to incorporate. Once I tackle any maladaptive thinking patterns that may be holding a client back through cognitive restructuring, I like to move into integrating acceptance and commitment therapy interventions. ACT does not seek to cure or control pain or other symptoms as a primary aim. The focus is on helping patients to acquire effective behavioral patterns guided by what they hold as important, their goals and values. ACT teaches mindfulness skills to help individuals live and behave in ways consistent with their personal values while developing psychological flexibility. It can help individuals recognize ways in which their attempts to suppress, manage, and control emotional experiences can create challenges. By recognizing and addressing these challenges, individuals can become better able to make room for value-based actions that support well-being. Ultimately, I want to disconnect my clients from struggling with pain and other symptoms and connect them to the rich tapestry and fulfillment that they can have in their life by centering their life around their values in order to reach their goals. This fullness includes a wide spectrum of the human experience, including that pain inevitably will accompany some situations and inhabit our body. This is where I guide a client to look at radical acknowledgement of their condition, which includes compassionate self-statements and continued focus on these 6 dimensions of psychological flexibility, of which we can have more control over in our life. When we look at these dimensions, it really opens us up to some interesting questions. In a few of the categories I just want to point out here, for instance, in presence, am I grounded in acceptance of the present rather than dwelling on the past or ruminating on the future? When we're focused on the past, that's where depression lives. When we're focused on the future, anticipatory anxiety, that's where definitely anxiety has a strong root. When we're able to come to the here and now, we can get a sense of peace. Now, I know what you're gonna say. Sometimes my here and now is painful, uncomfortable, and I don't wanna be here. And what I'm gonna tell you, and Eastern tradition is gonna tell you, then you're still too far in the future. The practice is aimed at coming to the moment, the breath that we take, and being able to trace that within our system. That's the concept here of presence, and we capitalize on those small moments. Another category that I love to look at is the question under emotions. Am I able to open up and tolerate painful emotions rather than struggle with them or become overwhelmed by them? It's challenging, but truly that's the difference between pain and suffering. As I've stated, we're going to have pain. We know that. And we're going to have it more than the typical person next to us, perhaps. However, do we have to suffer? I don't believe we do. When we look at the thoughts, can I step back and see my thoughts as just thoughts rather than giving them too much power when they're unhelpful? Sometimes when we think something a lot, we basically move it to the truth category. When we think it and we don't question it, it becomes an internal truth. So we have to be careful with that. And that's why support groups are so important, because we share those internal dialogues with others, and our support system can help us stay in check with that. Psychological flexibility is the ability to be in the present moment and be fully aware and open to our experience and to take action guided by our values. To put it more simply, it's the ability to exist, expand, and engage with what matters. We all have resiliency. Resilience involves maintaining flexibility and balance in your life as you deal with stressful circumstances and traumatic events. I want to look at, again, the concept of the neuropsychology of how we manage pain. As we now know, and neuropsychology studies have confirmed, that the central nervous system has the ability known as plasticity to reorganize over time in response to an individual's life, experience, thoughts, and actions. With a chronic condition, we can get mentally and physically worn down. In these states, we can get into a frame of mind that it's not beneficial to our coping. Previous research has found numerous changes in mental function caused by chronic pain. One example is that those suffering from chronic pain have difficulty making even simple decisions and interacting with other people during a flare-up. These findings make sense because of our overactivity of those specific areas of the brain involved in processing pain. Especially because of this constant internal brain stimulation, a person in chronic pain is impaired. The impairment is similar to what is experienced by those who are trying to multitask. Too many things happening in the brain at once makes concentration very difficult. I'm sure that this has been discussed time and time again as one of the major symptoms that we all probably have shared at some time is fatigue and brain fog. Today, I'm going to walk you through an example of one of many strategies I use personally and professionally to help with cognitive restructuring. Because when we catch the thoughts, we can replace them to create an outlook that empowers us. The Benson Henry Institute for Mind-Body Medicine at Harvard-affiliated Massachusetts General Hospital specializes in helping people learn techniques to alleviate stress, anxiety, and pain. Dr. Aileen Salisbury, an assistant clinical professor of psychiatry at Harvard Medical School who works with patients at the Benson Henry Institute, suggests learning several techniques so that you can settle on the ones that work best for you. There's no one best coping skill, just like there's no one kind of pain. I tend to think of these techniques much like flavors in an ice cream store. Depending on your mood, you might want a different flavor of ice cream or a different technique. Practicing a combination of mind-body skills increases the effectiveness of pain relief. So now that we know the why behind the technique, I want to demonstrate the how of cognitive reframing. Before I do so, I want to note what cognitive reframing is not. We have our little ribbon, love it. Okay, what cognitive reframing is not? Have you heard of toxic positivity? If you bought a poster in the 80s, you probably know what it is. It's that hang in there, buddy. And we know neurologically speaking, those little bursts of you got this, they last for about 7 seconds, a little up, and then we crash from them. They do not have long-standing impact in our changing of cognitive thoughts that lead to negativity. Really, they're just moments in time that feel good for a second, and then at worst can leave us feeling worse, and at best, they say about a 7-second increase in subjective happiness scores. So how does this kind of play out? Here's an example I put together from a few clients of mine. So a client shares, I'm having a flare-up. It's terrible. I'm sad that I must cancel my plans for today. It's days like these that just make me worry about the future. Toxic positivity comes in, well-meaning, but still, comes in and says, it's just today. Could be worse, right? Don't be so negative. And one that really gets us, don't stress out. Just be glad you don't even look sick. Push through it. When we hear these things, we know likely it's coming from a really good place, but we can't help but just feeling very alone in those moments. It sounds good, but it always strikes us kind of funny. If you've ever had that feeling, this is probably why, that there are other ways to validate. And I love these phrases for those that are here looking for ways to support their loved one. This is hard. You've done hard things before, and I believe in you. I know there's a lot that could go wrong. What could go right? All vibes are welcome. That kind of counters the good vibes only. It's pretty normal to have some negativity in this situation. And that counters the stop being so negative. How many of us have heard, don't be so negative, when we're talking very realistically about our experience with a pain disorder? So something to be mindful of, and perhaps don't be afraid to share this slide with others. That might be helpful for you to do so in your support network. So on to reframing negative cognition. Yay! I'm sure you're all celebrating. I just can't hear it, right? So this is the part where if you have paper and pen, feel free to pull it out. If not, these slides are available after the presentation. You can pull them up and you can do them with us. I'm going to take an example from a client and walk us through it, okay? But where I include the client example is where I'll pause to give you a moment to write down your thought or percentage or what have you. So here we go. So we want to start in step 1. What is a reoccurring thought that you have about your diagnosis or about your pain? Some of the most common that I hear is, I wish it was gone. I fear my flare-ups. I hate going or finding a doctor. Those are pretty common. In this example, we're going to look at our client today is going to say, I hate going to the doctor. Perhaps they have an appointment coming up and they're kind of ruminating on this thought. I hate going to the doctor. They just keep having this thought over and over in their head. What is the negative cognition? What is attached to this thought? So this goes a little deeper. So this is a little bit more about the emotion behind that thought. I hear a lot of times, I'm not good enough, I'm less than because I can't do certain things, I won't be believed, no one will take me seriously. In this example, we're going to use no one will take me seriously. What percentage do you believe this negative cognition? So something interesting I often find is that the percentage is lower than I often think it will be. And that's interesting. It tells us that there's a part of us that knows that this isn't a 100, but it doesn't stop it from being particularly distressful. The distress level is usually high, but the percentage we believe it is a little bit lower, usually. So that's interesting. And right there, that can point to some distortion in our thinking, which we all have. It's not just us with chronic pain. All human beings have distorted thoughts. It's because we generally are programmed to see the negative before the positive, which is a way that our reptilian brain protects us. We walk into a room, we automatically like, oh, you know, we're kind of looking like, that's strange, or why is that window over there? And it's not us being negative, it's an adaptive quality that we have for problem solving. So don't beat yourself up if you find that your automatic thought might be a negative one. Especially when we have a system that's in pain, we can go towards the negative a lot faster and longer. So in this example, we have a lower negative cognition percentage of belief, we have a higher distress level. This is subjective. Is this negative cognition distorted? Okay, so that's an interesting question. I want us to look at the 10 unhelpful thinking styles. This is one, print it out, look it over, and challenge yourself to not only find these thoughts in our own thinking, but listen when other people are talking around you, because we hear these all the time. It's impossible to go through a day and not hear someone do one of these. So when we look at the thought, the negative cognition, no one will take me seriously, which of these 10 unhelpful thinking styles does that negative cognition fall into? I'm going to put it in a few. Emotional reasoning, jumping to conclusions, all or nothing, disqualifying the positive. So a few I want to point out that are tricky. Emotional reasoning. Again, just because we think something doesn't make it a truth. Just because we feel something really strongly doesn't make it a truth. There is quite a neurological process between thinking and feeling and action. It's not automatic. So I love the example in that left corner, emotional reasoning, assuming that because we feel a certain way that we think must be true, therefore it becomes true. So assuming that just because we feel a certain way, that it equals truth, that's definitely a distortion, and it's a sneaky one that we do. And I love the example. Just because she's thinking about pizza doesn't turn her into a pizza, right? I love that this one also looks at disqualifying the positive. There could be a chance here that this next doctor could give us some insight that could lead us to where we need to go with our treatment. I'm not going to be using toxic positivity and selling you on that you're going to be heard and understood. We have beautiful, wonderful doctors here in the Spondylitis Association that are very validating and understanding, and they understand the struggles that we go through finding care that we need and accessing it. However, that may not be the case everywhere. However, we still need to embrace the opportunities and advocate for ourselves. We cannot disqualify the positive, and we can't jump to conclusions. If we do, it really stifles our behavior. So when we're ill, we often tend to become fixated on what we aren't able to do. Retraining your focus on what you are able to do instead will help us to have a more accurate view of ourselves and the world at large. So that is in part why it's so important to challenge these negative cognitions. Our step 2, I have the negative cognition up at the top that we're working with. No one will take me seriously. How can we use Wise Mind to reframe this negative cognition? Wise Mind is a beautiful tool from dialectical behavioral therapy. And essentially, dialectical behavioral therapy means we can hold more than one thing at the same time. So we're going to use this guide here to come up with a more balanced piece of self-talk, that we don't negate the emotions, but we also hold it with logic and reason to come up with that grounded, centered, sustainable, focused piece of self-talk. Here's an example. Though I have had negative experience in the past that may have made me feel invalidated, it is important I continue to advocate for my care, and I know I have the right to services and treatment to better my life. It takes some practice to get there, but it's important for us to not diminish our worries, but it's so important also to balance them out with more accurate ways of thinking that encompasses more of potential reality. So now that we've reframed it, based on that statement, take a moment, or the one that you are writing, take a moment and reread it. Though I have had negative experience in the past that made me feel invalidated, I can advocate for myself, and I have the right to seek treatment to better my life. What percentage do you believe this reframe? 80%. Okay. What stops you from believing the reframe 100%? I find that to be an interesting question. You think that 80%, you're probably like, well, that's really good, we should stop there. No, we're not going to stop there. I want to poke at it a little bit more. Why isn't it 100%? I'm not saying it should be, I'm just saying, why isn't it? And that's an interesting question, because this often gets us a little bit deeper into what we're holding. Holding on to a particular experience or fear. Sometimes the past experience with a provider has left us having some fear of future experience. We can go back and repeat the steps to get a little bit more insight into that. Step 3, when you read the reframe, what affirming feelings does it bring up? For me, it brings up resilience, hope, optimism. Where do you feel these feelings? I know it's such a therapist question. Where do you feel these feelings in your body? It's important for us to look for the positive feelings we feel in our body, especially when we get so many challenging feelings within our body. I feel it in my core, kind of makes me sit up a little straighter, a little more confident. Yeah, that's right. I have the right to seek my treatment. I have the right to be an advocate for myself. So I like to use that and breathe into it. And this is a 4-squared breathing technique, rescue breathing. It's also something that those that have experienced trauma use, those that are in the armed forces are taught this breathing style. It essentially calms our central nervous system down and elicits a relaxation response. So we breathe in and hold, breathe out. We can repeat this for a few rounds of it. And I like that as a nice grounding, centering technique. So the next piece I want to look at is the concept of wellness. We are living in unprecedented times, and we are coping with chronic illness during these unprecedented times. As COVID has diminished resources across the board for everyone, it has hit our community especially hard. It has put severe limitations on our ability to access our treatment professionals, vital medications, and health supplies. We have sadly lost so many precious lives. The grief is substantial. There is that pain, and there is the continued suffering during COVID-19. We know suicide rates have gone up, substance abuse has gone up, job loss, domestic violence. Complex stress adversely impacts our internal and external systems. We struggle to manage stress in our daily lives, and it's near impossible these days to not have it ever present in a much larger context. Sometimes it takes spoons we don't even realize it's taking. Linda Dugan, author of Mama Linda's Life Recipes, overcoming the effects of cancer and trauma, shared with me having to wait to bury her mother because the cemetery was backlogged. She later confided her migraines were so bad she could actually feel her own head pulsating. One client with chronic illness stated, a friend without chronic illness told them their frustration with COVID restrictions. They talked about how upset they were. They couldn't do the things they wanted to. They couldn't play golf or go for a nature walk. They felt helpless, bored, confused, and frustrated. They struggled with the limits to their autonomy. The client with chronic illness laughed as they shared this with me and said, "He thinks that's bad. Welcome to my life even before COVID." Since so much feels like it is out of our sense of control, I try best to help my clients focus on a wellness model versus a health model. The main difference between health and wellness is that the health is about physical wellness, whereas the wellness model encompasses all of these areas that we have a little bit more control over. According to the National Wellness Institute, the concept of wellness has 3 tenets. It is a conscious, self-directed, and evolving process of achieving full potential. It is multidimensional and holistic, and it's positive and affirming. There's no doubt COVID is impacting us in each of these 8 dimensions. However, by exploring these areas, we may be able to focus our attention on the spaces we can exact change upon. Some clients have taken to social media to advocate for disability rights. Others are pursuing educational resources or job training. This does not eradicate the difficulties we're having. However, it shows resiliency and adaptivity. And these measures are healthy coping strategies. What areas are in your wheelhouse of control these days? What steps can you take to increase your overall wellness? We cannot talk about chronic illness and COVID without discussing trauma. Trauma is a psychological injury to the mind that occurs as a result of a distressing event. Trauma is often the result of overwhelming amount of stress that exceeds one's ability to cope. We may be reluctant to use the word trauma to describe our experience. However, let's take a look at the 2 types of trauma. One is small t trauma. These traumas can be things like new jobs, moving, relationship ending, divorce, infidelity, or an upsetting personal conflict. Life stressors like financial troubles, work stress, diagnoses, prolonged health issues, legal battles, COVID-19 adjustments, all can fall under this category. Big T traumas are extraordinary experiences that bring about severe distress and helplessness. They can be one-time events like terrorism, sexual assaults, or they can be prolonged stressors like war and child abuse. Not only living with a chronic illness where your body attacks its own healthy tissue, but knowing we are in a subset of the population deemed high risk is a high stress situation. We know high risk groups may be at higher risk for developing severe symptoms and additional complications. Jessica Roberts, a dear friend, Spondy warrior, and author of the new blog, You, Me, and COVID-19 writes, "When I hear the virus only impacts those with pre-existing conditions, I feel marginalized. I'm reminded that those with chronic illness seem to be devalued in our society." She goes on to discuss hardships and being able to get into doctors even after several negative COVID tests. This is trauma. Validate your experience. Don't minimize your experience. Check in with these areas on the chart here. Advocate for your rights. Appeal decisions. Ask doctors to put their refusals in writing. Seek support as necessary. Join support groups. Seek counseling and share your experience. The concept I like to talk about is radical acceptance. This does not mean we have to like something. It means a radical acknowledgement of what we're dealing with. In a fast-paced society where every moment counts, what happens when your body can't keep up with the demand? For those with chronic pain, the feeling of being overwhelmed often can trigger a set of micro griefs. We find ourselves navigating the terrain of denial, anger, bargaining, depression, and instead of acceptance, we find ourselves stuck in the muck of despair. This despair consists of a lack of motivation, personhood, and of agency. However, there are ways to see through this with greater focus on wellness and resiliency. While pain is a part of life, radical acceptance allows us to keep the pain from becoming suffering by accepting the facts of reality without responding by shutting down. Let's look at an exercise very briefly. What are some realities that I might be refusing to accept? I need to rest during flare-ups might be one of them. What behaviors do I do when I'm refusing to accept reality? Ignore my body's needs might be one of them. How can I experience suffering when I refuse to accept reality? We can feel isolated, extend ourselves too far, our mood changes, we experience grief. These are some strategies that Marsha Linehan, the founder of DBT, recommends we use to help us with radical acceptance. They'll be available for you to go over. I ask that you look at them, study them, and see what ways that you can challenge yourself to work with radical acceptance. Here are some strategies for our loved ones to give them some perspective on how best to help us. I love using a scale to communicate how we're feeling. These are some great questions to ask yourself and to share with others. Take time to indicate what each level means for you. If you only have 14 spoons, be careful not to spend more spoons than you have. Pushing yourself too much today can lead to consequences for days. It is not your responsibility to make compromise for others if your wellness is already compromised. It's important that you advocate for yourself and understand where your levels are and communicate that outward. We very much are experiencing grief when we have chronic illness. When we think of the 5 stages of grief, denial, anger, bargaining, depression, acceptance, many of us think that this is only a process that we go through when a loved one passes away. It's simply not true. Denial may be something we experience when we tell ourselves it's not a big deal, it'll go away. Pleading or bargaining, please don't let this illness ruin my life. Anger can manifest when we say, this isn't fair, I didn't do anything to deserve this. Anxiety and depression, am I going to be in pain forever? Why even bother? Loss of a self or of our self-efficacy. I don't even recognize myself anymore. This has become my identity. When we move towards acceptance, we use phrases like, I'm going to not let this define me. I will learn how to deal with this the best that I can. Mindfulness is important. Mindfulness exercises can address many of the pieces of grief and loss issues, as well as the physical issues that may go along with chronic disease. Interesting enough, mindfulness exercises are moldable to many chronic disease circumstances. Mindfulness exercises such as yoga and meditation allow you to learn and be more present in the moment-to-moment, non-judgmental awareness. These mindfulness exercises allow you to change the way you engage with your inner experience. This change in engagement will allow for you to have a richer inner experience. I offer these free courses, no obligation to you. They build on the concepts of mindfulness, centeredness, guided imagery, and they can be available through thinkific.com at the Lotus Learning Institute. You'll see exercises in breathing techniques, mantras, progressive muscle relaxation, and compassion exercises. I know we're about out of time. Thank you for your patience. Having a mantra or a goal for the day can be a fun way to embrace mindfulness. Which one will you choose? Thank you for allowing me to share my time with you today. I hope that you find some useful tools in this presentation, and my deepest gratitude to the Spondylitis Association of America for the work they do to empower all of us to live our lives to the fullest.
Wow, thank you, Dana. That was such a wonderful presentation. We are moving into our Q&A session now. Let's see. Okay, so everyone, if you have not done so yet, please go ahead and type your questions into the Q&A module at the bottom of the screen, and we'll read them out loud for Dana to answer, getting to as many as we can. I'm actually going to stop this screen so that, Dana, we can see you as you answer questions instead.
Okay.
I just wanted to put the slide up for a few minutes so everyone will see the email address if you need assistance, programs@spondylitis.org. Okay. Okay. So let me open up my questions here. First question is, some of us have suffered from severe anxiety, depression, or obsessive compulsive disorders in the past and work hard to overcome them, but today's situation is causing me to regress and relapse into some of my old symptoms and habits. Is there anything that I can do?
Yes. So that's a great question. External stress and anxiety impacts us, no doubt. I would say make sure that these external stressors, if you can, try to limit your exposure to them to start off with. Turn off the television, take that time, schedule breaks, even I like to use my Google Calendar and just literally schedule 15-minute wellness time. Create a nice place for you to go and meditate. An app that I would use to help with stress and anxiety is a free app called Insight Timer. They have guided meditations for stress and anxiety. Sometimes listening to someone else's words can help get us out of our own head, especially when we have those intrusive negative thoughts that are often brought on by external stress. So that's what I would recommend.
Thank you. Just going through all the questions coming in. I want some advice as being diagnosed with AS. It affects my relationships with family, and I feel guilty for them not understanding. Is there anything I can do? And then there was a similar question that I kind of want to add on to that one. It again has to do with loved ones not understanding. This one was, some of my loved ones are not believing or really understanding my challenges, and it's causing lots of friction in my relationship. They don't understand why I can do something one day but not in another, and I feel judged and not believed. Just not sure how to address this and what to do.
Yeah, unfortunately, it's a pretty common situation that we can struggle with. We can be rather high functioning one day and almost debilitated the next. What I personally like to use is the scale that I included in the presentation. Print it out. There's no backdrop on that slide in particular because I want it to be accessible. Print it out, post it, make people in your life aware of it. Perhaps even share talks like this. Our conversation today is recorded. Invite them to listen to it. That's all we can do is lead them to the information. If they choose to not be informed, what I would say is continue to exercise your boundaries. You have the right to your wellness, regardless if someone understands that or not. Of course, we want them to, but don't be afraid to say no. For a long time, when I was first diagnosed, I found myself apologizing all the time. Oh, I'm sorry I have to leave early. I'm sorry I can't make it to this. We have nothing to apologize for. We have a chronic condition and we're doing the best that we can. And our loved ones need to understand that. And if they don't, though, we still have to understand we have the right to ask for what we need. So I just want to validate that you're not doing anything wrong. And I understand that sense of guilt. However, sometimes we carry emotions that aren't ours to carry. So that's why I make sure you join your support groups and, voice these concerns with individuals that understand it from a similar perspective as well.
That's so powerful. Thank you for that. The next question is about workplace issues. What are some good strategies for dealing with coworkers when you're dealing with AS? Employment arena is fraught with peril when you're talking about complications from a complicated condition, emotional complications even more so.
Right, absolutely. So it can be tricky to navigate that side of the fence. The better relationships you can have with management, with HR, that's important. However, again, we're still dealing with days where we can have that fluctuation of functionality, which is also confusing at work. don't be afraid to ask for what you need. If you need accommodations at work, consider talking with your treatment providers on what that may look like, and provide information upfront to HR so that that's on the record. So if you need certain accommodations made, those things can be provided to you. The Americans with Disability Act is in place for a very important reason, and that's to protect our rights. If we need to take leave, we have FMLA, most likely in many job situations. Some job situations do not, but make sure you're aware of what your FMLA services look like, because you're paying into them. And if you need to take advantage of them, then they're there for you to do so. It does require a relationship with your medical provider. So make sure you're in communication to your medical provider as well as HR if you need accommodations or FMLA leave to address symptomology.
Thank you. Is there anything you can share, or do you have an opinion on hypnosis for treatment?
Yeah, so hypnosis is an interesting, I personally don't practice hypnosis, but I have a lot of great referral sources that do. And essentially what we're looking at is calming the central nervous system. So any practices that do that can be beneficial. Some individuals have used hypnosis for other purposes, anxiety, cessation of smoking, with traumatic events and such. So it can be beneficial. I really follow the belief system of mindfulness and holistic wellness, which alternative medicine strategies such as hypnosis often kind of follows suit. So absolutely, if it's working for you, then continue to do so.
Thank you. Next question. I was recently diagnosed, although I've been suffering with this illness for about 10 years. I'm having a really hard time accepting that there are activities that I just can't do anymore, like running, which gave me so much joy.
Yeah. I think everyone just collectively nodded their head with you. It's really hard. And that's why I talk about grief. It's real. When we have a loss like that, my best suggestion is to maybe journal about that a little bit to get those feelings out and process them. Review some of the slides about radical acceptance. That does not mean that you like it. I kind of hate that word acceptance in there because it's like a false nomer there. It really should be like radical acknowledgement. And perhaps leaning in to these uncomfortable places and looking at what you can do and what might be some substitutes. Opening yourself up to more activities and socialization that fit more in our wheelhouse now. And follow your medical professional's advice. There might be some ways to systemically get back into some level of physicality. Maybe it won't be running, but it might be something that might have some similarity. If it was also the enjoyment of nature, we can still have those components in our life. I'm sorry to hear that loss for you, and I know it's substantial, and I just want to validate that as well.
Thank you. I'm just going to read a few comments before I go on to the next question, because this really is resonating with so many who are listening. One is, thank you for your answer. No apologies for my chronic condition. I'm doing the best that I can. I needed that. And there was another one that I wanted to read, but let me go to a question while I go ahead and find that. So based on the slides you showed, I've been experiencing trauma most of my life. A few people I've spoken to just ask, why can't I just get over it already? It's in the past. How can I explain that it's still very much in the present and I feel triggers?
Yeah, that's a wonderful question. Trauma is interesting because, the trauma is housed in a part of the brain that doesn't know time or space. So that's why you can be somatically triggered by it. And that's why we have trained trauma professionals to walk you through the process of healing. Trauma is not integrated, which means like a lot of other things. So like with depression, we can kind of integrate that into our life and understand it. With trauma, we can't because it's so foreign to our system, and that's why it's traumatic. So yes, it's very common that we can have an experience that happened 10 years ago and be triggered by it today. And that doesn't mean that there's anything wrong with you. That means that your brain is doing what brains do and it's protecting you. And when you're triggered, you get that autonomic fight, flight, or fawn, or freeze. And so we want to look at that in therapy just to make sure that we navigate and teach healthy coping skills so that that adrenal system response doesn't override us and put us in situations where we're shut down and there could be further trauma. So on my website, I go over a lot of details about trauma, and that's danahalltherapy.com. Please go to the trauma section. There's a video, there's articles, and I think you're going to see a lot of information that resonates with you in terms of why it is that something can happen chronologically a long time ago and still have a very relevant physiological effect over us.
Thank you. So I have a kind of a two-part question about cognitive behavioral therapy. One is, where can I learn more about cognitive behavioral therapy? And the other one is, it seems hard to practice this when I'm having brain fog. I'm already mentally taxed just dealing with my present situation. So how can I use this advice when I'm already drained and depleted?
Right? That's real. So a couple of things. One, cognitive behavioral therapy has been around for so many decades. It's one of the oldest forms of psychotherapy. So Dr. Aaron Beck at the Beck Institute is a great resource to look up. Again, on my website, I'll have links to these things. ACT, Acceptance and Commitment Therapy. There's a really fun book called The Happiness Trap, which talks about understanding cognition and value-driven goal setting and things of that nature. So those would be two great resources I'd recommend looking into. Yes, brain fog. When people don't experience it, it's really hard to describe it. We can't hold on to that cognition very long. So some of these techniques aren't meant to do when you have brain fog for that very reason. Instead, I would scaffold it and start with mindfulness. And again, mindfulness, we have brain fog. Okay, how do I do that, right? Insight Timer, another, just a reference to an app. There's a lot of great apps out there, Calm, Insight Timer, where you can put on a progressive muscle relaxation, guided imagery, and do some somatic work. I would start there. When I have brain fog, that's generally what I do. I have a really cool on the course that I offer for mindfulness, a self-compassion meditation, where brain fog is difficult to navigate through. We can also be very negative about it. We're experiencing it, so we're telling ourselves a lot of negative messaging. So the self-compassion meditation might be a nice foundational tool, and then we'll build up to addressing those cognitions in time. But don't feel like you have to do that. Address your symptomology as it presents. Don't force yourself to do a very high-level cognitive technique when you need rest and you need to deal with the stress and the management of that in your life first.
Thank you. The next one is, since the SIP, and I'm not sure what SIP stands for, I'm sorry, but since the SIP started, my depression has worsened. I'm on an antidepressant that is helping, but I'm still having trouble with insomnia and night eating. Any suggestions?
Yeah, there's a high correlation with trauma and chronic illness. Not saying that trauma causes it, but there's a high correlation, as well as with insomnia or hypersomnia, somnia. So with those conditions, what I would say is, we want to step back and look at our sleep hygiene routine. And I know we might think, well, we have a good one. Well, let's reassess it. Tonight, let's look at what we do from 7 p.m. on to bedtime. Can we introduce some things into our system that promotes a more holistic nighttime routine to help with some of that? You still may struggle, and it's not a cure-all by any means. But what I like to do is make sure that the sleep hygiene is there. Have some chamomile tea if you can, if that's appropriate for you. Relaxing book, watch your usage of screens, dim the lights. When we do that, we're sending the message to the brain to produce melatonin, which is a natural sleep aid. That's really great for our whole wellness system. We're preparing for sleep. Having that routine helps the structure of sleep as well. Also, on top of that, if you're not reaching a restful sleep, I'd recommend revisiting that with your physician, as there might be an underlying sleep condition. So we want to maybe do a sleep study and see if there's anything impacting your ability to reach REM sleep. So if you feel several days of unrest and it's not part of your normal cycle, then I would lean in and talk with a treatment professional about that. There's some supplements and other dynamics that might be recommended, but don't take anything unless you talk with your doctor. I have lots of clients talking to me about supplementation and telling me it's organic and all natural and great. And also they can have interactions with other medications. So before trying anything, even over the counter, run it past your doctor, because I know many of us are on several different medications. So we want to look into that.
Right, that's so important. Thank you for stressing that. Next question is about dating. I've almost given up on dating because I just come across so unreliable when I have to cancel or postpone a date due to a flare-up. Plus, I feel tremendous guilt toward anyone I do date because they have to, quote, put up with me and will have to deal with all my symptoms, bad mood, brain fog, etc. I don't want to force that on someone. Any advice?
Yeah, dating is complicated in and of itself, and especially dating now during a pandemic, dating now with the advent of all the technology and the swipe right kind of culture. I feel like we can also devalue ourselves. What do we have to bring to the table? Well, you are not chronic illness. That is a part of your life. And when we look to make connections with people, I want to remind you to kind of pull back and look at the plethora of things that you offer as a person. You know, your hobbies, your interests, your values, your beliefs, the life you want to build with someone. All of these values are so important. And also you have a chronic condition, and that does require someone to be mindful of that. And perhaps it's an easy way to weed people out. If they're not willing to give you the time to get to know you and they judge you based on that criteria, then my guess is we've probably saved some time in the long run. I know that's easier said than done, and I'm sorry that you're experiencing that. There's a wonderful podcast by Dr. Lee Phillips. They are truly amazing, and they talk about chronic illness and dating and sex and all the things. And so I'd encourage you to check out Dr. Lee Phillips' podcast. They might have some good, helpful information and feedback on specifically dating with chronic illness. But my big piece of advice is don't undercut yourself, don't discredit yourself. You deserve to be loved fully and completely, with chronic illness or not. So.
Thank you. Absolutely. Next question is, I'm having to change my diet and it's causing me anxiety and fear because no one else in my house will be doing it with me. Yeah. I'm wondering how to deal with the anxiety about making such a big change.
Yeah, changing diet is huge. I mean, it's one of the biggest components in our life, because I mean, that's an everyday occurrence, and we get used to habituation and pattern when we talk about eating. I'm not a dietitian. Just want to preference that. So, but I want to say that on my reference page, there is a link to chronic illness and chronic disease publications in terms of nutrition, some peer-journaled reviews around the topic of nutrition, diet, and integration into your life. Some of my takeaways there are to try to make it a pattern of wellness for yourself and perhaps introduce that to family members. Often the way that you'll be eating is away from processed foods and sugars, sustaining use of alcohol, this sort of thing, which is good practice generally for all. So maybe inviting the family to take part in that could be a nice way to make it a meaningful experience. Trying great recipes. I talked about Linda Dugan's book that she has about chronic illness and trauma and eating well, and that's in the slides as well, the link to that. She does a great job of really fun recipes for everyone in the family, for kids and for adults. But yeah, I would lean into this new experience. I know any change can be anxiety producing, but it's an act of self-care and wellness, and what we put into our system makes a big difference. So good for you, and embrace it, and have fun with it.
Thank you so much. We have a question about workplace again. So so I've decided to give notice at my part-time job on Monday. The job has rolled back all the COVID precautions, and I'm on a biologic, an insulin pump, steroids. How can I phrase this in a way that does not place blame or shame on myself or my employer, yet is firm no matter what the response from my supervisor is, who is not really understanding of disabilities and my condition?
Okay. So if I'm hearing this correctly, okay, I just found it here. Okay, so you've decided to give notice. Okay, so I would put that in writing, essentially that due to the indications that you've mentioned to us, at this time, I feel that this environment is not safe for me to continue employment. I've enjoyed my time here. I've appreciated learning X, Y, and Z. However, due to my pre-existing health conditions and the lack of PPE available to us, I'm no longer able to continue work here. I'd also probably recommend you consult with, if you're considering leaving the job, maybe consult with an attorney, have a consultation, perhaps before if you're deciding to leave and that's just a decision you're making and that's a firm line, then continue on as we discussed. Put that notice in writing, address why. However, if you are on the fence, perhaps write to them and tell them why, contact HR and let them know of your pre-existing health conditions and how you're negatively impacted by the current environment. Also, there should be guidelines in place, not only to protect you as someone who has pre-existing conditions, but to protect others in the office as well. So I would put that in writing. Perhaps they would be willing to revisit their stance. And if so, perhaps you take a leave until you feel safe to return. But I applaud you for doing what you feel like you need to do to protect yourself. Absolutely. You need to make sure that your wellness is a priority.
Thank you. Absolutely. I often hear or see people online say things like, spondyloarthritis has my body, but doesn't have me. I get that this may be someone's reframing device, but to me, it sounds like toxic positivity. Am I being too cynical?
Yeah, I mean, I think that we hear these good-natured kind of comments, that are not coming from a place, but if you're feeling invalidated by it, no matter if I don't feel invalidated and you do, it's still relevant. And it's, your experience to be able to scroll past that and not internalize that messaging. If you're getting that, this strikes me wrong, then absolutely listen to it. Unfortunately, people do kind of make these over positive statements because it feels nice to deliver them. They want to do something for us. And, it's just not the most appropriate way to validate us. Instead, there are suggestions that we can offer the people in our life. And maybe we can share some of those posts after our conference today, just letting people know, maybe sharing the slide if you feel comfortable or things like that, or a way to kind of get that messaging out there of other ways that we can show support for those that have chronic condition.
Thank you. And I think we may make this our last question. So a question about a child who is imitating their the parents' AS reaction symptoms, and just wondering if you have any insight to share into this or any input on how to appropriately address it.
Yeah. So as you shared, I have 3 small children, and my children haven't done this yet. I suspect it's a pretty common experience when they look up to us and they role model and they mimic us. They're mimicking a behavior that they see demonstrated and they don't really understand the intentionality behind it. I would recommend using story to help them understand what it is you're experiencing in an age-appropriate way. I use social stories. So telling the story of something. For instance, my fibromyalgia amps up in cold weather. So I might tell my son a story about going to get the mail in the winter and how I have to bundle up and I can feel it kind of aching. And so I might go like this. And I demonstrate the posturing. And I'm doing that because my body hurts a little bit more in those types of temperatures. So I know I have to take care of myself, X, Y, and Z. So we share a little bit of our experience, not to scare them, but and also age appropriately, so they don't worry about us in a way that usurps adult nature, but just making it a part of conversation. The other night, after doing one of these stories, my son noticed that I was exhibiting a pain response, and he came over and put a blanket over me. And I thought to myself, wow, they are watching us. They are truly listening. So I would take that moment and just, let them know a little bit of your experience with pain and why it is, and give them permission essentially to just offer a blanket or a hug, and that I think you'll see that behavior kind of dissipate. I think it's a matter of their natural desire to connect, and they do so by mirroring. And once they understand what's going on, usually they pull away from that behavior pattern.
Understood. Wow. Well, Dana, I can't thank you enough for this just completely enlightening, validating, wonderful session that we've just had, both the presentation and the Q&A. It's been such an incredible pleasure having you with us. So thank you. Thank you for that.
Thank you. Thank you. And thank everyone for staying with us today. I know it's been a long day and there were several presentations and a lot to do, so I appreciate that as well. Thank you for these wonderful questions.